I am Dr. Shaun Franklin. I am a family physician and I teach here in the residency program at Phoebe. My primary message is that I have received the COVID vaccine. I encourage people for their safety to get the vaccine, also for the safety of their family, their friends, their community. We are the only ones that can stop the pandemic by getting the vaccine and going back to our lives. I know a lot of people have talked about this being a really new vaccine, but the technology itself is not new. I mean, it's over 20 years old. But this is the time that we've had an opportunity to actually put it in practice. And so this particular vaccine works by identifying a protein on the virus and then allowing our cells to see that protein, then make antibodies against that protein. So then when we actually see the virus itself, then we are aware of it. We start making antibodies fighting against the virus, and then we avoid becoming very ill and avoid death. The vaccines are very safe. Our FDA goes through a rigorous process to approve the vaccines. After approving the vaccine, then the CDC chimes in on the information about the vaccine. And then the ACIP, which is the Advisory Committee for Immunization Practices, will receive all of this information. And then after everything has been evaluated, there have been tests, people have then been recruited to volunteer for the vaccine. We find out what are the side effects, what are the potential harms. We then weigh the risk, we weigh the benefits, and then we decide benefits outweigh the risk, and we use the vaccine. For this vaccine, the sequencing for the virus came out like January of 2020. When the sequencing came out, instead of keeping everything a secret and only one company working on the vaccine, you had unlimited money, resources, scientists from all over the world, everyone working together to get this vaccine out. That is the difference. You can still get an infection, but the key is the infection will not be as severe, no hospitalizations, no deaths. That's the key. Use trusted resources. The CDC, the ACIP that I mentioned. Most importantly, use your physician. Your physician has a lot of good information. You've developed a relationship with them. Trust them.